Hi, my name is Kristy, and I will be palpating an assessment on you today, focusing on your upper back, especially on the levator scapulae, rhomboid minor muscle, and the root and the inferior angle of your scapular. So the assessment will be involving using my fingertip to gently palpate the area to assess to your muscle tone, muscle texture, temperature, and any tenderness on the area mentioned above. For this assessment, I will be assessed to your upper back and shoulder region. You will be asked to lay down, face down on the sheet, on the treatment table, and I will expose only the area that need to be assessed today. Um, there is a small risk that palpation may cause temporary discomfort or may re-injure the previous injury that you had. Please let me know if you feel any discomfort. I can stop or alter the way of palpating right away. Um, yeah, do you have any question before we begin?
No.
Do I have your consent to proceed?
Yeah.
Okay, so please remove the upper clothing to your comfort level and laying down. I'll be waiting outside, wash my hand, and then come back for the assessment.
Okay.
Okay, thank you. So right now I'm gonna assess the 4T on his back region and also like his cervical. So the first one I'm gonna assess is the temperature. So I'm gonna use my whole palm, and then I'm just gonna assess. So it feel warm here. When I go more laterally, both sides it feel a little bit cooler. I'm going up to the cervical. The cervical also feel warm. And when I go a little bit to the outside, it feel cooler. So in general, like the middle to the spine and the cervical area is warm, and then the outside laterally gonna be cooler. So right now I'm gonna use like the pad of my finger to assess on his skin for the texture. Okay, so the texture here in that different direction on his mid back is pretty mobile. When I get close to his lower back, it's more restricted in the lumbar region. The more I move up to his upper back and also the cervical, I can feel it's really mobile. Now I'm gonna assess on his tone and tenderness. So I'm gonna use like the tip of my finger, putting a little bit more pressure to find some different type of tone that I find. So here in the erector spinae, I can feel it's a little bit ropey. On this side, I will check on the other side. Oh, I can feel the ropey here. Okay, I'll move a little bit up here. It feels really burly and like soft and smooth. Alright, so let's go back here. Young one, do you feel a little bit tender here?
Yeah.
Okay, yeah, so I can confirm the tender and also the tone. So right now I'm gonna palpate the root of the spine of the scapula and also the inferior angle of the spine of the scapular. So I'm gonna start with his acromion and I'm gonna go alongside with his spine of scapular here until I find like the changing in the angle here, so I can confirm this one is the root of the scapular. So I know it's gonna be a line perpendicular, go straight to the SB of T3. So I'm gonna start from T7, which is a really prominent bone here, and then I start cutting down. So T1, T2, T3, and then from here I will move in, so I can confirm this one is the root. And also from the root I will go alongside of the medial border of the scapular until I find a changing in the angle. So I think this one is the inferior angle of the scapular, and I know it's gonna be aligned with the T7 SB. So I'm gonna go from the root, go in here, it's gonna be T3, and then I'm counting down T4, T5, T6, T7, and then I'm just going inside. I can confirm this one is the root of the inferior angle of the scapular. Now I'm gonna palpate his levator scapular, so I know the attachment gonna be the posterior tubercle of C1 to C4 of the TVP, and also it's gonna be the medial border to the root of the scapular. And I will just put 2 fingers up to identify like the superior angle of his spine of the scapular. So I know like this is the one of the attachment, and I'll find the TVP. So from the mastoid process, going inferiorly and posteriorly, I'm gonna find, okay, this is TVP of C1, C2, C3, C4. So from here, and then it's gonna, the direction of the fiber is gonna go down like this. So my cross fiber palpation gonna be like this. So I will put a little bit pressure because it's under the upper trap. Okay, so I can feel some like bulky muscle over here. So to confirm the muscle, young one, can you please stroke your shoulder? Okay, so it's point directly into my fingertip. I can confirm the muscle. Okay, now I'm gonna palpate his rhomboid minor. So I know the attachment gonna be the SP of C7 and T1, and also it's gonna attach to the medial border to the root of the spine of the scapular. So at first I'm gonna find his scapular. Okay, so this is the medial border here, and then I'm gonna try to palpate until I find his root. Okay, so I feel the changing angle here, so it's around this area here, and then the other one is his C7, so I'm gonna find a really prominent one, C7, T1. Okay, so it's gonna look like this, and the direction of the fiber go like this. So I'm gonna do cross palpation. So I'm gonna go a little bit deeper because it's under the trapezius. Okay, I can feel some muscle fiber here. Okay, so to confirm the muscle, young one, can I ask you to bring your shoulder blade together? Boom. Okay, it's really obvious on young one. I can confirm the muscle.